Periodontal disease in the United States is an epidemic. We have over 50% of our population suffers from periodontal disease, according to the CDC. We have 330 million people in the United States. There's close to 160, 170 million people that have periodontal disease. Yet only 3% of the patients with periodontal disease get treatment. I'm a periodontist. I get many referrals to my practice from general dentists and from other healthcare professionals, but yet very few of them are for straightforward treatment of periodontal disease. Most of them are for bone grafting and dental implants and connective tissue grafts, but very few patients are referred to me to treat periodontal disease, an infection that affects 50% of the population. It's the sixth most prevalent disease in the entire world. It's an epidemic, and it leads to other health problems as well. My first year in dental school, 1975, I met Dr. Harold Lowe, who many of you may know. He is the father of modern periodontology. He was the first periodontist to tell us that bacteria leads to gingivitis. And it was a very simple study. He took 21 dental students at the University of Oslo, where he was from Norway, and he suspended oral hygiene for 21 days. So for the first 11 days, he cultured them every day. And what he found is that within 11 days, 21 out of 21 of these dental students had bleeding gums. They didn't brush or floss for the 11 days. But all of them were prone to gingivitis or inflammation of the gum tissue. On day number 11, when all of them had gingivitis, he gave them the toothbrush back and he said, you can now start to brush. And he cultured them. He cultured them up until 11 days, and he cultured them from 11 to 21 days. What he found is that bacteria changed in association with no plaque control. And the bacteria changed to bacteria that were more prone to having inflammation. So he was the first person to ever prove that gingivitis was caused by bacteria. This was in 1965. It wasn't that long ago. It was just a little over maybe 50, 60 years ago that he found out that bacteria lead to periodontal disease or gingivitis. Now, not everybody who gets gingivitis is going to go on to periodontal disease, but every one of us is prone to gingivitis. So Harold Lowe, because of his philosophy of treatment, told us on our first day of dental school that we were physicians of the oral cavity, and we were responsible for getting people periodontally healthy. He felt so strongly about this that we had to treat periodontal disease on every patient that came in before we did any restorative dentistry. We had to get their plaque levels down to less than 10%. And in Clinic 4, which was the periodontal clinic, we called it the Periodontal Hotel. And we were joking about, maybe the movie Psycho by Alfred Hitchcock. The Periodontal Hotel was, once you check in, you never check out, because it's very hard to motivate patients to get down to a plaque score of 10%. Bob Barkley, who I talk about often, was also another dentist that tried to get patients' plaque score very low. Matter of fact, back in the 1970s, Bob Barkley wouldn't treat a patient until their oral hygiene was excellent. He charged them $10 a visit to show them how to brush and floss. And once they were able to brush and floss adequately, then he would present to them comprehensive dentistry. How many of us today spend time teaching our patients oral hygiene? We almost give it lip service. We say to the patient, you're doing a good job, or you should do better, etc. But we really don't spend the time that we probably should in educating patients. And this is a problem, because our dentistry is something that rests on the foundation of periodontal health. If we don't have periodontal health, all the restorative dentistry that we do, all the implants that we do, are going to fail. So why don't we treat periodontal disease? I don't really know. I think it's almost like a habit, because it's something that we really don't look for. It doesn't stand out. Patients don't say, I got a 5mm pocket, will you treat it? So patients don't come to us saying, hey, fix this. It's sort of like the leaky roof that's not leaking too badly, it's just dripping a little bit. It's not that symptomatic. But once periodontal disease becomes symptomatic, it's very hard to turn the tide. So prevention is sort of key. Now, periodontal disease is also associated with a lot of other diseases, and patients are now reading this. The paradigm for illnesses and disease has been shifted from not from infection to one of inflammation. Now, we're not quite sure that this is all true and is all gospel, but most diseases have an inflammatory component. Periodontal disease is inflammation. It's inflammation of the oral cavity. And the inflammation of the oral cavity leads to inflammation throughout the body. We've known since the 70s that people who are diabetic and have uncontrolled periodontal disease, it's very hard to control their diabetes. We've also learned that people who have uncontrolled diabetes, it's hard to control their periodontal disease. Those go hand in hand. What we're also starting to see is that many other diseases, cardiovascular disease, dementia, stroke, even some forms of cancer, are associated with high forms of periodontal disease. Almost every week in the Journal of Periodontology, we see an article written about something, a systemic condition, hypertension or asthma, that is associated with periodontal disease. Now, it's not direct cause and effect, but there is definitely an association between inflammation and systemic diseases. So I think it's important for our patients to talk to them about that. Almost all my patients know about Bradley Bale and Amy Doneen, talking about the book that they wrote, Beat the Heart Attack Gene. And I've written a number of books and blogs about the relationship between inflammation and periodontal disease and inflammation systemically. Matter of fact, I became a patient of Bradley Bale for a while and flew down to see him because cardiovascular disease runs in my family, and I flew to Tennessee to see him. Before I saw him, he said that he needed a full series of radiographs, a cone beam CT scan, and he wanted all sorts of bacterial testing to see what my bacterial levels were before he would examine me as a patient. And he's a physician. I thought that was a little over the top for a periodontist that has 2 and 3 millimeter pocketing, but I did it anyway. So I thought that was interesting that someone from the medical field feels so strongly that we should treat dental problems as well, because dentistry is part of medicine. We're physicians of the oral cavity. In parts of Europe, you have to become a physician before you become a dentist. And that's what Harold Lowe had taught us, because he was from Norway. He said, we need to take care of this. We need to treat the whole body as well. So we treat comprehensively. We do a comprehensive examination when a patient comes in, not only dentally, but I talk to them about their oral health as well. So when I talk to patients, I talk to them not only about the pocket depth and the inflammation and disease, I talk to them about the systemic health. And it's very motivating to get patients to do a good job. Now, there was an article or a study published by Concordia, the large medical dental insurance company. They looked at something like 56,000 patients. And they looked at them for 3 different things. Do they have coronary artery disease? Have they had a stroke? Or do they have dementia? And then they looked at them to see if they had periodontal disease. And what they did was they took half of those patients that had periodontal disease and put them through scaling and root planing. And they got their oral hygiene under control. And what they found was that for that 1 year that they did that study, the patients that had scaling and root planing, that also had one of the comorbidities, diabetes, cardiovascular disease, dementia, stroke, they found that the patients that had periodontal disease that were treated with scaling and root planing spent less time in the hospital than the ones that didn't. Matter of fact, the savings were anywhere between $1,000 and $5,000 a year for the patients that had better oral hygiene. So why not treat it? Why don't insurance companies pay more for this? That's something that I don't know. I don't know the answer for that. But it doesn't really matter what insurance companies pay. It's important that I tell my patients that they have a problem, they should treat it. Who wouldn't treat an infection if they had it? If you had an infection in your hand, would you not treat it? So why are we not diagnosing and treating more? That's a question I have for you. It's there. And if you don't want to treat it, just diagnose it and have your hygienist do the scaling and root planing. Because very few of these patients are getting treated. As I said, less than 3% of the patients that have periodontal disease are getting treatment. And a lot of them don't see the dentist, but a lot of them do see the dentist. And I see it on a daily basis, patients that come in with periodontal disease that have had recent dentistry. Why wasn't a periodontal disease treated as well? So I think it's incumbent upon us as dentists, as healthcare providers, to educate our patients and give them the options to take care of things. It'll make a big difference. It'll make a difference in your practice and for your patients. And one of the cool things about it, my patients that are periodontally involved and periodontally healthy and understand the value of taking care of themselves, they're going to want to take care of themselves in other areas as well. They're going to want to do comprehensive dentistry. They may want to do veneers or orthodontics or replace missing teeth with implants. Because an educated patient is our best consumer. There used to be a guy named Cy Sims. He had a furniture store. He used to say, an educated consumer is my best customer. Well, an educated person is going to do what's best for them. Now, I don't have to tell patients what to do. All I have to do is educate them. And guess what? They usually make the best decision for themselves. So I implore all of you, do comprehensive examinations, do probings, do radiographs, do charting. Explain to your patients what's going on in their mouths. Explain to them it's important to get their diabetes under control. It's important not to smoke. P.D. Miller has talked to us about this for years. Smoking increases the rate of periodontal disease 250%, 250%. So it's important to coach your patients. So it's a great opportunity for us to be a gift to our patients. to ourselves, to our team, just to get people healthier. Because if we don't do it, who's going to do it? Thank you all for listening today. I hope I've motivated you to do comprehensive periodontal examinations and explain it to your patients, because it's a great opportunity for everyone. It's a win-win. Thanks, and have a great day. And remember, be the gift.